speaking.
The convener, leader, chair of the Coalition of Indigenous Peak Groups, Pat Turner. And I want to come to the important reason that we've gathered together today to speak about the finalisation of the Closing the Gap agreements that have been historically reached between the group of coalition peaks, the Commonwealth and the states and territories. This is a very significant day, and I know one that both Ken and Pat have been working together on now for some time, and I'm so pleased that we've come to this day. I think it's going to have a very meaningful impact on how we progress to ensure that young Indigenous boys and girls can grow up in this country with the same expectations as non-Indigenous boys and girls in this country. That's what we want to see. That's what it's all about. That as Australians right across the country, we can have the same hopes, the same aspirations, the same goals, ultimately. It's not an easy road, and there's still a long road ahead of us to achieve that. But what we're announcing today, I think, will make a very meaningful impact on achieving that journey together. But before I do that, and I know with the indulgence of both Pat and Ken, I must start by saying that the numbers that we've seen today in Victoria are obviously very concerning, and I share the Premier's concern about those. I also support the actions that he's taken on the advice that I've received also about the rate of transmission that is occurring in Victoria, and we will be sharing with the Victorian Government any further advice that we have, drawing together the work of the expert medical panel, the HPPC, who are meeting now, I understand, and any further advice that would come forward from that collective group as to what may assist in Victoria. We will certainly be sharing that with the Premier, and the instance of cases throughout the community, and particularly extending out on the Melbourne metro area into the Geelong region and surrounding areas, is of great concern. And we have now been in this lockdown now for some weeks, and we are not getting the results we would hope for. And as a result, the further measures that are taken are certainly necessary. They will come at an impact to the economy, and we understand that. But equally, not containing these outbreaks will have that effect also. And so it's important that we continue to work together to get on top of this and to take whatever actions are necessary. The decisions are being driven by the data and by the evidence, as the Premier said. And the actions that are being taken specifically to reduce mobility in the affected outbreak areas are very important. And I would just continue to encourage people to comply and work cooperatively with the requests that are being made right across Victoria and elsewhere around the country. The most concerning part of the information released today was that there were a further 13 deaths. That brings to some 189 deaths now in Australia as a result of COVID-19, and some 105 that occurred in Victoria. 10 out of those 13 deaths occurred in aged care. And I will speak further after I have addressed the issues with Minister Wyatt and Pat Turner on the announcements that we're making today. But there's been a series of further measures that we've been taking there, which have been making some progress. Aged care cases, including staff, account for just around about 10% of the total cases announced today. Specifically in aged care, there were 16 cases of residents. The balance, 74 in total, 58 were staff. And staff contracting the virus, my advice is predominantly from community transmission. So with that, let me turn, with your agreement, to the important reason that we've gathered today, as serious as the pandemic is, the issue of achieving those aspirations for Indigenous and non-Indigenous Australians together are of great significance to our country, not just now, but into the future. It is a national aspiration, a national goal, a national task. The process that we began around about 2 years ago, when we came together, began with listening as to why we were being unsuccessful in closing the gap. Any good process starts with listening, and that's what we did as a government. We listened carefully, and there were many discussions. And there were many very unprecedented discussions, including here in this very cabinet room, as I sat earlier this year in January, together with Indigenous leaders from peak groups, with Ken, and that was quite an extraordinary discussion. And it charged us up to keep going with the work that was being done to form the agreement which we've reached today. As we've been dealing with the pandemic, there have been two phrases, two concepts that have come up in almost all the briefings that I've had. They talk about lines of effort and they talk about unity of effort. And as I was reflecting on this agreement last night, I believe that's what this does. It sets out very clear lines of effort, which has been important, but more importantly, it sets out the process of having a unity of effort. And when we do those two things together, that's where we make progress. Whether it's attacking a pandemic or attacking the very serious issues of Indigenous disadvantage for Aboriginal and Torres Strait Islanders in this country. And the other thing we did is we listened and we identified these things. And we looked at how we had not been making the progress all of us wanted on closing the gap. We reflected on the fact that closing the gap and the initiative taken by Kevin Rudd was an entirely worthy initiative and an initiative deserving of credit. But innocently, there were elements of how that was done which was misguided. That's not a criticism. That is a learning of these many years that have passed since then, as we've sought to live up to those worthy aspirations at that time. And one of the mistakes that have been made is, as we've looked at this as a federal government, we've decided what the gap is. We didn't look at the gap through the eyes of Indigenous Australians. We told Indigenous Australians what the gap was that we were going to close, and somehow thought they should be thankful for that. That was wrong-headed. That wasn't the way to do it. We needed to understand what the gap was, looking through the lens and the eyes of Aboriginal and Torres Strait Islander people. They needed to tell us what the gap was that needed to be closed. And that's what this task has been about. It has also been about understanding that this is not the task or role or responsibility of any one organisation, level of government or nation of peoples across the country. This is the task of us all. And for that to be successful, we need a partnership between all of these groups, understanding what these lines of effort are to achieve this unity of effort. And so we set about achieving a partnership and setting out these 16, as I understand, particular areas of activity, underpinned by 4 key things we're seeking to do to make them possible. And the first of those is partnership, a partnership of states and territories who have significant roles to play in achieving the outcomes that are set out here in this agreement. This is not something the Commonwealth can even pretend to think it can do alone. It must be done together with the service delivery and policy arms of state and territory governments, but also with the delivery agencies of Indigenous organisations which are on the ground making a difference. Secondly, it's about building the capabilities of those on-the-ground, community-based organisations in Indigenous communities to deliver those services as best as they possibly can. It is about transforming mainstream government agencies and institutions and how they conceive these challenges and how they go about engaging and delivering their services and broader policies that impact on Indigenous Australians, whether they're directed to them specifically or not. And it's about getting the right data, the right evidence and the right reporting that creates the transparency to drive the actions we're seeking to get progress from. The data then, as it's set out in each of these 16 areas, is incredibly well presented in terms of what we need. It sets out the goal, and those goals haven't changed drastically. But what it has done is identified the things that make that goal achievable and the signs you need to look for along the way to know you're going to meet that goal, and how we're progressing against those key data points. And it gets granular. It says we're not just going to look up here, we're going to get down to community level. We're going to go and break this up by different groupings to understand where the real challenges are and where our progress is doing well. As Ken has often said, this process has to acknowledge the gains to drive the confidence that other areas can see achievement. But it's also about separating out where the accountabilities lie to get the action. And then there is the further data that is needed to drive the whole process. And there are some serious weaknesses when it comes to the intelligence and information that we need to inform plans to eliminate Indigenous disadvantage in this country as much as we possibly can. And so I find it a very practical document, Pat and Ken. I commend you on the work that it's done. It's realistic, it's shared, it's evidence-based and led, it's transparent, it's practical, it's ambitious. And from this point, the real work starts. It does. And the plans that are needed from the federal government, from the state governments, the plans that need to find their way into budgets. But I tell you where we start. We start with what we have to do, and then we apply the resources to achieve that. This isn't about buckets of money. This is about changing the way we do things and ensuring that we apply the resources most effectively to achieve that.